Okay. So today we are going over chapter 3 and 4, and then tomorrow 5 and 6. And that will be everything for the week that's going to be on our exam. So chapters 1 through 6 is going to be our exam this week. There is a worksheet for chapter 4 that's up, and it's going to be done kind of together in our live, most of it. You can just fill in the questions as a study guide for chapter 4, kind of. A little bit of a help for you for that. And then there's also another one that's up in the week for chapter 6 that we're going to go over tomorrow, radiology administration. So I don't want you to do it yet, but tomorrow after class, you may want to go ahead and fill in that one. It's more like a glossary of terms and an outline you can kind of fill in after we go over all the radiology administration stuff, because that's kind of boring. We'll try to make it fun tomorrow in class. I got a little activity we do with that chapter.
You said chapter 4, we're going.
Yeah, chapter 4 today. So that worksheet, we're going to kind of do together some of it on the live today. So you can just kind of fill it in. There's some scenarios and things we're going to do. That's one of the questions. Chapter 3 is no PowerPoint, like I said. It's basically education survival skills. So as we were waiting those few minutes while you were reviewing your quiz, I was playing study music. So if you've never used that to study with, it's usually classical type of music. You don't want something loud and heavy like I know some people like to study with, because that makes your brain not remember things as much. So it's some kind of study was done that says classical music helps you to make connections and remember. So if you like to do that kind of thing, that could be another study technique you could use. I also have another tip that I found last year through a friend of mine. It's an app, and it sounds crazy if you've never done this kind of thing, but positive affirmations, you get your mind retraining things and you say it, and it really does make you start to get to that goal. If you write down goals, it makes you get to your goals. So it's called Think Up. It's like a little leaf on the app when you go to the Play Store. And there's all these categories. I know you probably can't see them, but it already has categories for you to record yourself saying, and then it plays it over and over again with music in the background. There's motivation, confidence for a new career, stress relief, prayer, relationship. But the ones I want you guys to focus on is the better sleep, the studying, public speaking. If whenever you get ready to do your paper and have to stand up in front of the class and say everything you have to say, you might want to do some of those positive affirmations for public speaking to get your mind in the right thought. But it's a really free app. There is a paid version. With the free version, I think you can only record 3. And then I had to uninstall it and reinstall it because I'm cheap and I'm not paying, but then I could pick different ones. But another thing you can do is just scroll through it and pick the ones you like and write them down or copy them to something, and then you don't have to use the app to record them. But there's a lot of categories on it, and it's called Think Up, and it's like a little leaf. It's an orangey colored leaf. It's that one with the leaf right there. I highly recommend if you can just do it on your drive to school on those days, or do it every day, because I did see, I wasn't doing it recently, but when I was doing it every day, I saw changes in things. And whenever I have students that are really stressed out and I tell them about it, they were like, oh, that helps a lot. The chapter itself has a lot of things that you probably already know from just being in life, or if you've been in school for a while. So I'm not going to go over everything in the chapter, just tell you to read it. And if it hits to you, some of the bullets are good. The managing time management. Miss Stelz is like a calendar organizer person. If you need help with that before you go to clinic, she will actually sit down with you and help you get a schedule together to plan your life with you. If you want, I can talk to her about coming in and talking to you guys about that. But for now, it's kind of crazy. Everybody's getting used to trying to do these Zooms from home and learning from home. It's a much difficult for our classes, because your mind isn't set to like sit at a computer screen and listen to someone talk to you for 3 or 4 hours. So being in the classroom is much better, because we break it up with activities and we do stuff and we have breaks, and it's way different. So trying to take some of this to heart, and managing your time while you're at home is mostly important for the study part of it. So that after you're done with this live session, you don't sit here and rewatch it right away. Give yourself a little mind break and then come back, check out the live again, look at your notes, and then see if there's anything you missed that we were talking about during it. And then also on that, there's a little picture in here. Stress relievers, exercise, nutrition's really good. Study technique section on page 26. I hear someone said she was up all night studying and she's tired. Don't study for long periods of time. Your mind can't absorb that much. So you want to do short breaks. Study for a little bit, go for a walk, do something else, do the dishes, come back, study a little bit more in chunks. And that way you will retain more, hopefully.
That's what I did
Also,
the first quiz, and it's like, I guess in the beginning with this course, I feel like if there's a time where I'm not studying, then
falling
then it's,
behind.
but yeah, so I have to not think that way.
Basically, whatever the professor goes over, whenever class is done, then you guys have to go back over everything. It's like just whatever she goes over, then you have to basically go back over what she said. Just read the chapters. That's also another good way to remember everything. That's what I was told. So once you're done with school, go home and study more on, whatever we have the quiz. And that's just one way to remember everything that was talked about, because that's what I learned the hard way. And I had somebody tell me that the best thing to do is just go over everything in the book and right after class.
Yep, pretty much. Like look at it, look over it, see if there's anything you missed while we were going over it. So on page 28, there's some bullets, study techniques for study skills. Those are really good. Review it soon after you're introduced to it. Don't wait till the day before the final exam or the exam to start going back over the whole week's worth of material. Use your senses. We're going to do learning styles in a little bit. If you've never done that before, there's a little quiz I found, and you can see what your best learning style is. Miss Dean doesn't really believe in them. She believes everybody's a mixture, but there are some that are better at hands-on, and some people that are better at listening, and some people that are better at reading it. I do believe you have a stronger preference to one or the other, but we try to do a little bit of all. That's why we ask for you to read the chapters beforehand, so that way when we're talking about it, it's clicking in your head some of the things that you read, and that way you also may have some questions from that. We also do activities. If we can incorporate something that gets you up and moving and doing for some of the things, but some things just aren't made that way. Some of the stuff, we just have to read it and memorize it. A lot of our stuff, and the reason most of you are here, is hands-on. So the lab is your favorite part, and that's where you really go, yes, I get it now. So the hands-on part is usually, most of us are kinetic learners or hands-on learners, but there's always a little mixture in there. So test taking tips, that's another important section on page 29. So like we were talking about earlier, go in with your first instinct. Don't go back and change your answer. I do like skipping if you don't know it and coming back to it, but sometimes that takes people's time. And I feel like the people who mostly do that usually run out of time on exams. So I would suggest go ahead and marking what you think it is and make a little notch next to it, or say, no, write a piece of paper 22, I need to come back and double check. If it's a test where you can go back and double check. Our exams, you can do that. It's not going to be one at a time like the quizzes. So that way you don't run out of time and have a bunch of blank answers. Some of our exams will have fill in the blank. So just be prepared for that. Sometimes on the quizzes, we do fill in the blank too. After the test, I have so many people, if they don't do good on it, they like shut down and they don't take that opportunity to review it and see why they missed them. And that would not give you an opportunity to improve. So take that test as a learning experience if you don't do good on it, and see why you missed what you missed. Did you pick between two answers that was the wrong one? Were you confused at what it was asking? Did you just totally not study that and you guessed? So that way you can know what you need to study. The hardest thing is not knowing what you don't know. And that gets us into the learning styles activity thing we're going to do now. And then we'll start on the critical thinking chapter, which is always so interesting. Critical thinking, who would have thought there'd be a whole chapter on it? So under the week in Blackboard, there's a link to a little survey. So I'm just going to have you guys take about 5 minutes or whatever it takes for you to go through and do the survey. And then if you want, you can share your results if they were what you thought they were or whatever in the chat. But it's mainly just for your own knowledge if you don't know what you are. I think I'm going to take it because I haven't done this in a while.
Again?
Under week 1, I have a link. Let's see. It's the bottom, I believe, kind of close to the bottom of week 1 tab stuff because I added it last night. So all the way down under the quiz. Ooh, I need to talk about HIPAA.
Week 1 PowerPoint?
Let's see. It's not under the tabs there, so let me find it. It might be under today. Today is Wednesday. Let's click on Wednesday. Learning styles inventory. There it is. The Wednesday homework folder. And it's trying to open on my computer now. For some reason,
it's
not
20.
open.
It's 20 questions.
Yeah, so it might take a little bit, maybe 10 minutes to do.
Do you want us to tell us what we got when we're done?
That's up to you if you want to share it. You don't have to.
I'm 35% auditory, 15% visual, 50% 50% tactile.
Oh, wow. And I
But
like how it gives you the little bullets of things that you can do for your style.
I mean, I always thought I'm more of a kinesthetic learner. Like,
That's the tactile. You are. Your highest was that.
so tactile is
The kinesthetic on hands-on. Yep.
okay.
Yep. So under that, where it says that all of the things that you can do are probably more hands-on stuff. "45 visual." So Michael, it said sit in the front of the class for visuals. So you picked the right seat yesterday.
I just like being in the front. I feel like I'm gonna miss something if I'm in the back.
I sat in the front too, and mine said visual, and I didn't even realize it when I was a student. I was more worried about people in front of me distracting me, so I didn't want to be behind people. Auditory.
Yeah, I didn't even read it before. So yeah, tactile 100%.
All right, guys. So keep that in mind. I guess hopefully some of those tips will help. So critical thinking. I think I got the PowerPoint downloaded. Yes. At 10 o'clock, the writing studio, Mr. Zach, is going to come in and teach us and talk about APA style. It will help a lot for your future class projects. This class, I actually found out the new edition of APA. You guys will be happy to know you do not have to do a reference page for an interview anymore. So yay. You just cite it, personal communication in your paragraph with whoever it was. You don't have to do it on the reference page. So no reference page needed for your paper.
Does that mean it's only one page now?
Yeah.
Okay.
So you don't even have to submit a reference page. He messaged me back that yesterday because I told him about the project, and I was like, oh, okay, sounds good. Whatever you tell us. Your numbers didn't pop up. Did you go all the way to the end, April? Through all the questions?
Yes, I did it twice. It gave me like the list of, the description of each type of learning style, but for like how everybody has like 10% and stuff like that, I didn't see that for me. So I don't know.
Yeah, I
I
don't
went
know
through the whole
either.
test twice. I don't know.
So we're going to have the students from one of the upper class, Miss Osteen's class, is going to come on our Zoom on Monday of week 3 and talk, and we'll put you guys in groups with them. So it'll be smaller groups so you can chit chat and talk and ask questions.
So we don't have to have that cited source, but we still need to have it in our paper.
Yep, just answering the questions and giving who you talk to in the paper. Yep.
Okay.
Let's see. All right, so we're sharing the screen now.
I have a question real quick, if I may. So the assignments in our medical language that I have done, how do I get them to you? I've taken pictures of them. I didn't know how do I get them to you?
So in that, when you click on that description, there's going to be an upload, browse my files that comes up. So when you click on the assignment, and I have it set for unlimited upload, so however many it takes for you to upload it, I'm not going to go through and be like trying to read a little picture and see what you put on it. So if you have any questions, if you were right on the answer, let me answer that for you individually. Ask me, send me a message or something. It's just to see that you did it. And then we will do some chit chat, talk about some of the terms from that week after our exam. We'll review some. I have a whole medical term like matching game that we do as a competition. You guys are so competitive. It's funny. When we are on campus one day, we'll do that towards the end of the class. But anyway, it's just to see that you did it and make sure you're going through the ones we want you to know for the weeks.
Okay, so are those going to be on our test as well?
So you will have some medical terminology, probably no more than 3 or 5 from the week's questions. So to see if you know any of it.
Okay. And how many questions, if I may, I'm sorry, how many questions is the test?
So most of our exams are 100 questions. I'm having a hard time coming up with 100 questions this week. So it may be, I have a couple of point ones that I've made 5 points for your essays. So it may be around 75 questions, but still 100 points total. Mm-hmm. So critical thinking, problem solving today, chapter 4. So some of the main things that you want to be able to define or do before we get on through for our exam is define what this critical thinking and problem solving is, how important it is to us, being able to think about our role in situations that we might encounter in clinic. So making the right ethical and technical decision making, and some of the steps that the book lists as the steps that are involved in problem solving. So there's actually things that you want to do in a certain order to get to the correct answer instead of just jumping to what you think it is first. Looks like I have a chat. Okay. And then being able to also work as a team and then go back and see how critical thinking was involved in that. We have lots of instances where we're either working as a team with other radiographers together or other members of the healthcare team where you may have a conflict happen where you don't agree with how the thing is being done. You might not be the person in charge, but you still might have to be putting input into getting the end result, especially in trauma in the ER. Doctors, different people are doing 5 different things at once, and you're still trying to get your x-ray in a timely manner at the same time. And then you're going to analyze it afterwards, identifying professional solutions that you could use to solve these problems. And we're hopeful that as you go through clinic and you get in more and more situations, you're going to develop better critical thinking and problem solving skills. That's one of the things that actually in our interviews with our students before you graduate, we do mock interviews that she said she noticed that she got better at throughout the program, the more situations she was in. So we'll talk about ethics in another chapter, but we have a code of ethics that we go by, and you probably have your own ethics that you're ingrained into you right now. But as a radiologic technologist, you're going to follow a certain ethical standards that we have to obtain for our profession, and making sure we're applying that when we're thinking of the patient first. So some of this seems like it's like jumping ahead to me because we haven't went over ethics with you guys, and some of these scenarios that are going to be given today are things you haven't learned yet in class, but we will see how you answer them without us going over it. So like the HIPAA and things like that, you haven't went over yet, but you may know it from just going to the doctors, or if you work in medical, you may already know what that means. So here's a scenario. In the operating room, we do this type of x-ray, which is a cross-table lateral hip x-ray. The leg that's up in the air is in the stirrup. That's not the hurt leg. The leg that's getting surgery is over here. And we have to think critically to get this big C-arm camera under the table without knocking into the patient, without knocking into the doctor that's usually standing there, without touching any of the sterile field because it's usually in the middle of a surgery. So this is a big creativity, adaptivity comes into play in x-ray all the time, especially when the patient can't extend their arm out or move in the position we want them to. We have to use our critical thinking a lot to get the picture that we need. And if we have a patient who's got dementia or is drunk, out of it, a kid that's not going to listen, so lots and lots of thinking outside the box critical thinking is going to be dependent on our patient. Every patient's going to be unique. So afterwards, you could always self-reflect and think, what could I have done differently for next time to get that faster or better, or to have them cooperate more? And I don't know, you guys only know me for 3 days, but I'm kind of matching with my name, I feel like, a little bit until you guys take the test, and then they're like, you're supposed to be Miss Love. But I had a patient, I don't know what was wrong with them, if they had a brain tumor or whatever, they were like, I don't want you to do my x-ray. Like I was being mean to them. I don't know. I had to leave the room and let another tech come in and do the x-ray. And I was like, I'm going to cry. But no, sometimes you just have to figure out what you can do to get the exam done. And there was 4 x-ray techs in the room. So if the patient didn't want me to do their x-ray, of course, I'm not going to do it. Another person came in and did it. I do not know what was wrong with that patient still to this day, why they were acting like that. Maybe I reminded them of someone they didn't like. I don't know. But critical thinking requires more than just simple recollection of knowledge and facts. You're going to develop better skills in the more situations that you're in. So sometimes role playing helps, lab simulations. That's why we do lab comps here on campus with you guys. We actually do trauma labs before you graduate, putting you in a little bit more difficult scenarios. And just asking you situational and judgment questions on exams. So that's also why we have some fill in the blank questions on our exams, to see how you're thinking on subjects instead of just guessing on a multiple choice. So critical thinking is a skill that's at a higher level, and it usually requires analyzing something, applying, or evaluation, or all 3 mixed together. So first thing we're going to do is identify and clarify problems if you're in a situation. So when I give you your scenarios in a little bit, there's going to be a short little synopsis scenario. You're going to kind of think, what's the problem here and how are we going to realistically solve the problem? And then before you jump to the first solution, think of all solutions, or how you could, what's the best choice after you think of all the different solutions. So we do critical thinking in the classroom, in the lab, and in clinic. So today would be a good example of us doing our critical thinking skills in the classroom. When we go into the lab room tomorrow, I'm going to have you guys some scenarios like putting in a 14x17 portrait at 40-inch SID. See how you get to that correctly. So in the lab, that'll be an experiment type situation or hands-on. And then when you go to clinic, you're going to be doing that like consistently. Every single patient is going to be different. So you're going to be critically thinking all the time. So ethical things, I feel like we should look at this code of ethics, even though we're not on the ethics chapter today, because it keeps talking about it. Let me find where to look in your book for that. Page 339, it's Appendix D. There's 10 code of ethics that we are to abide by, and most of it is just common sense things you would hope that working in the healthcare you would do. So just want you to look at that for a few minutes. We're going to go over all 10 of those when we go in the ethics chapter. But basically, responding to patient needs, being professional, supporting your colleagues, as long as it's providing good patient care. I don't know if this is the chapter that has a situation where the tech is being mean to a patient. I think it's in the patient care chapter. But if you're in another room doing an x-ray and you hear someone roughing up a little old person acting mean to them, what would you do? You could go to the supervisor. You could go in the room and stop them, and you could take over the care of the patient. So lots of things we could think of. Being respectful. So we're not going to judge people based on their socioeconomic status. You may get homeless people. You may get a person who was just the driver of a drunk driver accident and killed a kid, but you still have to take care of them. Sometimes that's hard. Without having personal concerns with the disease or illness or discrimination. We had HIV a long time ago. Now we have COVID. There's some people that would be scared to go in and take care of a COVID patient or refuse to or not want to particularly. And I think that was happening with doctors in the beginning. Doctors were barely going into those patient rooms and the patients were alone. Nobody was wanting to go in there and really talk to them or take care of them because they were too scared they were going to get COVID too. That we use our equipment how it was supposed to be used. Trying to see if there's any other ones that are. Privacy, confidentiality, that's a big one. And to always continue to improve our knowledge and share our knowledge. We are the experts of our field. So just because you're working with a doctor and they probably don't know everything we know, they didn't go to x-ray school for 2 years. They maybe had a 1 or 2 day lecture about safety of x-rays and things like that. So they do look to us to be the safety for shielding and distance and contrast media. We've had to come up with protocols.
Are we joining the lean toss one or are we joining?
Somebody's not muted.
Nancy Man lean toss one. I got two more here.
You go to this.
Candy.
Call this number.
Yeah, I just did. But this I clicked on that one.
I think I can mute her. Okay. All right. So now you know a little bit about what they keep referring to when they're talking about our ethics and our responsibilities. All right, see, this is where we're getting into the scenarios, if it'll come back around. So I think we understand that, trying to think of it seems like my mind is like gone with the scenarios that I've seen. One would be a hip that's broken in the emergency room where they can't straighten their leg, move their leg or anything. You would need to adapt. And you can't barely move a patient in that situation. So we are trying to do no harm. We don't want to harm them by moving their leg and causing the fracture to possibly cut an artery or something, but we still need to get two opposing views of this, and we do have to move them somewhat. So we need to work as a team in that situation with another tech to help us to get it. And sometimes there's like these people, we call them super techs, and they think they can do everything, and they're sometimes hard to work with. So you have to figure out how your role when you're working with that person too. You have to adapt to the different personalities, especially being a student. You may come into a clinical setting where there's a lot of older techs who have been doing this for a long time, and they're a little bit jaded, and they don't want to work with students. Or maybe they're a new tech and they're unsure of themselves and they don't want to be the one showing you because they don't want to show you the wrong way. Or they're not ready to let you take over and do it because they want to make sure it's done their way. So they take over and do everything. Even if you had it just a half an inch off, they would go in and move it and fix it. So you'll see lots of things like that when you go to clinic, but you just have to get a quick check on, because you're only there for a short amount of time, everybody's personality and know how you can help out with each person a little differently. So that's going to make you be really adaptive in different situations. We work a lot in the ER, especially with doctors and nurses. Sometimes you'll work with anesthesiologists and respiratory therapists. So the more you can have a good relationship with those members of the healthcare team, they're going to help you out, helping you move patients, lift patients, tell you if you're really on good terms with the nurse. Sometimes they will not pay attention to you as you're walking down the hall with your big loud portable, and sometimes they'll see you. So it just depends on the day, the time of day, and the nurse, but if you're on good terms with them and you know their name and you can say, hey, so-and-so, they can help us save us from doing an x-ray on someone who didn't really need it right now. One scenario would be a chest. If there's a chest order that came in, but that nurse knows they're fixing to put a line in and they're going to order another chest in 20 minutes and they see you going in that room, they can stop you from wasting your time doing that chest x-ray and say, hey, we're fixing to put a PICC line in this patient. Come back with that order. We'll use that for the PICC line check in 20 minutes when the doctor gets the PICC line in, or the nurse. It's usually a PICC line nurse. But if you weren't on good terms and communicated with your other healthcare and you were just walking around the hospital ignoring everybody and doing just the orders that came in your job, you would be doing double work on that patient because you would have did the chest x-ray that originally ordered, and then in 20 minutes you'd get another chest x-ray. That's happened a lot in the hospital too. It's just communicating with the other people in the healthcare team. We used to have to go physically to the nurse's station and look at the chart and check and initial the order before we could go do the x-ray. Well, now it's all digital. So x-ray orders just come up on our screen and we don't even really have to communicate with the nurses really anymore. We just take the computer's word for it that this person really needs an x-ray, where sometimes it's not ready yet. They just put the order in early and they really wanted it after they did a certain procedure. So it gets really hard for us. Sometimes we get double orders. Sometimes we get orders from the ER waiting room where they went to get triaged. You know, when you first go in the ER and they take you in that little room and do your temperature and stuff, and then they put you back in the waiting room for 2 hours. Well, sometimes the nurses will go ahead and put in the x-ray orders before the doctor even sees them. So we would get orders for a hand, a wrist, and an elbow. And then when they finally get seen by the doctor, all they really needed was a forearm. So we get double orders that way too. But that's nothing we can do about it because we got the order coming through. But what has happened because of that, seeing that happen in certain hospitals, the radiology manager identified that there was a problem. People like nurses ordering x-rays that weren't needed. And so they made it a standard that we wouldn't do any x-rays from the waiting room. We would wait till they seen the doctor and make sure those are really the x-rays that were ordered. So sometimes that's how new protocols get put into place. And we're kind of the most, I think all of the healthcare, you have to have adaptability, but we have so many different scenarios. We're coming across every single exam. We're going to need to be really adaptable and flexible in our everyday operations. And students, that's a hard one because you guys are getting thrown into a situation from 1 month to another month where you may be going to a totally different site with totally different people and personalities, where your adaptability is going to come into play even more. So as long as you know what your role is as a technologist with your ethics, you should be able to make sure you're doing the right thing for the patients. So that's why I'm like, this code of ethics is really important in these steps. But it's pretty much common sense things you would already do, hopefully, by treating the patient, not discriminating, using the equipment as it was intended. I can't even think of a scenario where somebody would have used x-ray equipment for something not as it was intended, but that's in there. And making sure that you are competent to do the exams that you're doing. I actually just got a text from clinic that one of the students told her clinical site she wasn't allowed to make exposures. That's our job, guys. So I want to make sure everybody knows when you guys go to clinic, you can push the button and make exposures. You are not supposed to do an exam without direct or indirect supervision, depending on your level of competency on those exams. So I don't know where her confusion was for that, but we get you out there to clinic so you can take exposures and do exams. But as long as you have direct supervision on something you're not comped on, you're good. That's going to come in tomorrow when we go over all the clinical stuff. And the more patient interactions you have, the better it's going to be for your critical thinking skills. As a student, I feel like you're dependent on the tech you're working with. Whatever they want to happen in the situation, they're the one taking the lead. You've got to just follow. So sometimes it's hard for you to develop those critical thinking and making the decisions because you're not able to yet until you become the tech. If you're at a site where it's just you and maybe one or two techs, like an orthopedic center, I know some of our students, they just give them the room and they go in the other room and do x-rays. So you're in there doing everything for the whole day, the whole shift. And if you need help, you ask. So in those situations, if you're that kind of place, you're going to get a lot of critical thinking because you're going to be the only one in the room trying to figure out how to do these things. We give you lots and lots of practice at school, but we give you practice on each other where you guys aren't making it hard on each other. You're actually positioning yourself sometimes, trying to help your fellow classmate out. So once you get to clinic and you get a patient who's a little difficult, it becomes a little bit different than the scenarios we have in the classroom and lab. So I'm going to put you guys into some breakout rooms now. We got 4 scenarios. So it's a little different doing it on Zoom, but I'm still going to have you guys act out. So hopefully there's probably going to be 2 or 3 in a room. So if it's only a 2-person scenario, maybe your third person can read the case study to us. And then the other person, one person's going to be the mom, the other one's going to be the young female getting the history. So actually this one would need 3 people, 1 being the tech, 1 being the mom, and 1 need being the young female. And you guys are going to act it out and how you would handle the scenario. If you are in room 2, you're going to do case study number 2. So in a minute, I'm going to give you guys the breakout. And then you're going to, hopefully one person in your group has this already open, the PowerPoint for today, if not all of you. So you can look and see what scenario you're working with. Case study 2, case study 3, case study 4. So once I put you in your room, you're either going to be 1, 2, 3, or 4 room number. That'll go with your case number. You're going to figure out as a group who's going to do what and what you guys are going to do based on your scenario. Give you about 10 minutes, maybe 15 if you need extra. And I'll come in and check on you and see if you're ready. And then we're going to come back in here and you guys are going to talk it out, act out your scenario, and tell us how you handled it basically in your acting it out. Let me get back over to Zoom so I can put you in breakout rooms. These scenarios are in your book. All right. Super excited to see everybody's acting here in a few minutes.
I'm an actor already, so.
Hello.
Everybody's jumping back in. And then at 10, we have the writing studio coming on, so maybe we'll be done right on time.
What time will we be done right on time?
Well, we are going to do the writing studio at 10, and everything's being recorded, so that way if there's some of that APA stuff that he goes over that you need, it'll be here on the recording. Also, I'm pretty sure he has like some sort of handouts and things like that on his shell of Blackboard.
He's going to be showing us slides, right?
I don't know what he's going to show.
If he's showing slides, you guys might want to take pictures. He's going to blow through it. If I remember who he is, you guys might want to have your phones out, just taking pictures, because he's going to.
Yeah, but it'll be recorded, so you can always go back and get the pictures
confused.
if you need them,
what
or
are we
whatever.
doing? I'm sorry, what are we doing?
So the writing studio is coming on at 10. So hopefully we'll be done with all our scenarios and the critical thinking by then.
Okay.
So group 1, go ahead and let's do your scenario.
Get back to that. Hi.
Hi.
So we're group 1. I'm gonna be the one to read kind of what's going on, and then my group will act it out. So we have human diversity. It says your next patient does not understand English. You need to escort the patient from the waiting room and give her instructions for the procedure, including removing all the clothing from the waist up and any metallic objects from the chest and abdomen area. You then need to take the patient into the examination room, place her in the correct position for the procedure, and after completing the procedure, you need to give the patient exit information. So you need to identify the problem, investigate, formulate possible solutions, and then interact the best solution.
This does happen.
All the
All the
time.
time.
Okay. All right. So I am let me see, am I on speaker? Okay.
Yeah.
I'm the actual tech, and I'm going in to meet Miss Robinson. Hello, Miss Robinson. My name is Tawiley. I'm here to take you down to do your x-rays, but I need to verify some information from you. Can you please verify your date of birth?
No habla. Un poquito.
Okay. So I'm trying to show Miss Robinson the paper to see if she understands what I'm asking her, and Miss Robinson still doesn't understand it. So I'm gonna go and meet with one of my colleagues, and I'll be back. Miss Robinson, hold for a minute. And so I'm gonna leave and go talk to one of my colleagues and ask her if what do we do in this situation?
Okay, that's a good solution. Are you guys done? That's the end?
No, where's
Okay, let's see
where's
what
the
goes
other?
on.
I can't remember what her name is. I'm not good with names.
Who else is
Brooklyn.
in?
There she go. Brooklyn. Brooklyn, we have a Miss Robinson in room 1, and she doesn't speak English, and there's no interpreter on the premises at the time. What do I do in this situation?
Okay, yeah. My best professional opinion would be to go ahead and use as many hand gestures as you think possible to let her know what article of clothing to remove or whatever's necessary. And I would also suggest to use Google Translate to verify all of her information that's necessary.
Okay, so I think I'll go ahead and use my phone.
Okay, yeah, sounds good.
All right.
Yay for Google.
Miss Robinson, can you verify your date of birth for me?
Señorita Robinson, ¿puede verificar su fecha de nacimiento para...
Tell her to hold her breath. I want to hear how it says that. Take a deep breath in and hold it.
Mi cumpleaños es febrero 7, 1986.
Good.
And now it's in.
The end.
Yay. So so number 1 would be hopefully the facility has an interpreter. So if you're bilingual, that is a very good thing to put on your resume so that you will be called all the time to help translate, even though you're not the paid hospital interpreter. Another option, which the book says do not use, is a family member if they had somebody with them. Usually it's a child because the child usually knows both. And then that was excellent that you guys went to the Google Translate. So that worked out really good.
Yeah, I use
I
that
also
at my
regret
job.
taking French in
Sometimes
high
I
school.
do that situation.
All right. So group 2.
We had patient interaction, and it was called, is this elder abuse? We had Bob, that was a radiology technologist, and he was working with an older patient, and the way he was interacting with him was not really acceptable. And we came up with the conclusion that you basically I'm sorry guys, I'm nervous. You have to tend to the patient's needs and basically put yourself in that patient's shoes, and my other people in the group will explain the.
Yes.
This is my favorite scenario to see act out in person. We had somebody throw somebody against the wall and the clock fell off the wall in the classroom one time.
All right. Well, we'll do the best I can in our homes.
Yeah, I know it's a little hard in home.
Okay. Where's our old man and Bob?
I'm Bob.
Okay, there we go.
Who was
I'm the old man.
Who?
the old man? Okay.
Okay. And I'm the other radiologist in the other room, chilling.
Okay.
Minding my business.
Okay, so I'm the radiologist tagged on Bob. I'll be taking care of you. Put your arms up. I don't have time for this. Can you hear me? I said, keep your arms up, you old fart.
Ow!
Uh-oh, he
I
fell.
can't hear you. Yeah, that was me falling. I can't hear you. That hurt.
What is going on over there? Oh my goodness. I need to get up and investigate. I go in there and, you know, when I walk into the room, I find Bob, the radiologist, holding the old man up against the wall. So
The old man.
I pretty much, you know, the old man, you know, he's looking kind of crippled up on the wall. So I asked, like, what's going on? So I immediately jump in to help. Like, are you okay? Do you need any help? Like, what's going on? I help the radiologist and I help the old man. I try to do everything all at once just to get the situation back down to normal. And then then I might even have to take over for the radiologist because it may be too much or he's having a bad day or the patient may not want to work with the radiologist anymore. So I jump in, I handle everything that the patient needs. We get him out. And
Bob
then
needs to retire.
at this point,
Bob will retire.
take a step forward. And then I just have to figure out the next step is, you know, to report what I heard and saw to the supervisor on shift. And at that point, I'm out of it. You know, I did my part and it's in their hands now.
Yeah. Yes,
So
the best
that was
things.
pretty much it. It was kind of hard to act that out, but.
Yeah, try to diffuse the situation, check on the patient. Maybe
Mhm.
Bob really caught the patient as they were almost going to fall and Bob didn't really throw the patient down. We don't know.
Right.
We don't know what was going on in there, but
Only
report
Bob
what you
knows
saw.
what happens, right?
Yeah. Number 3.
Okay, so Alina and I are working on case study 3. I will read the prompt. You work as a mammography technologist in a small community hospital. After the morning activities have been completed and while you're at lunch with your coworkers, you overhear a conversation between 2 hospital staff members regarding a mammography patient you saw earlier that morning. The conversation of the staff members is not subtle, and you are certain almost everyone in the immediate area heard some portion of the conversation. You're also aware that the information you overheard is clearly inaccurate.
So I'm helping out. I'm the other person that she's having lunch with over here talking about the mammogram. Yeah, I heard Dr. Jones said that it was a tumor.
Oh my gosh, I can't believe it. I heard it from her family members also.
Yeah, and I don't think she's going to make it because she's let it go on for so long.
Wow, that's interesting.
Hey guys, you know, I think that ethically it's not right to be talking about my patient's information around other people, and it could be HIPAA violation. If that patient's family members outside of the door, they could possibly hear something that you guys are saying, and also the things that you're saying is not accurate.
I don't think anybody overheard us, but I guess you're right.
I can't take her serious. Well, it's possible that somebody could have heard you. So I just think that, and next time in the future, we should just be more careful.
Okay. So HIPAA violation, that one was basically it happens. Sometimes you have been dealing with the trauma patient that didn't make it and you did their x-rays in the ER and then you see them up on the floor and they're being recovery from the surgery that they did. And you're like, wow, I can't believe that was such a bad accident. Remember when they just came in, we didn't think they were going to make it. Just in general conversation in the elevators and stuff like that. But just think if you were that family member that was getting on the elevator as somebody was talking about your family member like that, you wouldn't want that kind of conversation going on. Or if it was something really bad that they had and you were talking about, oh, I had to go do that patient who had C. diff. I hope they hurry up and don't have to go back in and do any more x-rays. It smelled so bad. And that was their family member walking by the hallway while you were talking about it. So be careful where you say stuff. And another thing, even if it's not that exaggerated bad, anything that happens in clinic usually gets back to Miss Caldwell or Miss Stelz. People hear everything and text her, and you might not even think about it. We had a student one time, can't even believe I'm telling you guys this, that would sit down and sleep at clinic. I don't know what's wrong with people sometimes.
Did they pass?
No comment.
No comment. HIPAA violation.
Oh. And they didn't think it was going to get back to Miss Caldwell. All right. So that was number 3? No.
Yes.
Okay. Number 4. Ready?
Number 4. So myself, Michael, and Sarah have a case for emergency. Basically, the patient comes in, is scheduled for radiation treatment on her skull. Michael has to perform, she's sick, nauseous, and everything else. So he's going to have to ask her if she's feeling okay and everything else. I identify the problem. What is his first course of action going to be when he realizes that she's nauseous? He's going to have to investigate the problem. What might happen if he runs into the room while the radiation therapy is going on, and formulate possible solutions.
And I'm walking into the door. Oh,
With my mask on.
Oh, Sarah, hey, oncology, radiation oncologist. We have a situation in here. She looks like she's going to throw up, so I'm going to walk in here and I am going to undo the screws on your mask, simulate proper removal of the immobilizing head mask.
Hold on. What do you have there? This is good.
This is great.
Just, she's going to throw up. I have to help her, okay? So I'm going to undo the mask because she has a fear of throwing up in the mask, and we don't want her to choke on. We don't want her to choke on her own vomit because she's laying flat on the table looking up. So I'm going to remove the mask. I'm going to raise her up. Sarah, you're going to be okay. Just try and breathe. You're okay. I've got a trash can here in case you throw up. If she does throw up.
Okay, he gets the award.
We did not know he was doing any of that.
We had no clue he was going to do that.
So I'm going to recommend to the physician that she needs some kind of anti-nausea medication because this could happen in the future. And if she's strapped in on the table again, immobilized with the mask, the risk of her throwing up and choking on her vomit is too much. So I'm going to have to see if the physician's going to recommend if this treatment can continue or if she's going to have needs to have some type of medication.
Oh, man.
So she didn't throw up. So that's good.
You did great, Michael.
We pictured.
Michael, what is that?
What is that?
That's what I was trying to figure out.
Oh,
it looked like a head.
That was really good.
Good.
I thought you would like tape something up to make it look like a head.
Oh man,
that's funny.
Number 1.
I lost it. That was amazing.
Oh, my eyes! I'm tearing up.
We were
Great
like, we
job.
just gotta act. He's like, I got this.
Yeah.
And I come in their group, and he's like, I'm not really sure about this. Acting like he didn't have a clue of how to act this out.
And I thought I was the actor.
Oh man.
Number
Like,
6.
my Oscar.
Or did I skip too far? Number 5? Number 5.
I don't know how we're supposed to top that. Like at this point,
I know everybody's like, "Oh, I'm done."
I told
I was
him
just
we
helping
needed
a
to
patient.
set the bar. I told him, I said, you got to set the bar.
Well, good thing you didn't go first. Everybody would have been like scared to go.
We were scared to go last because we thought we were gonna suck.
All right. So
It's okay. There's no real contest here.
Okay, so it's night shift, and we noticed on the image it appears to be there's a 1-inch gap between the apex and the lung on the rib cage on the chest. That was on the image. So Ms. Green's in the process of being discharged, and she has a fear that there might have been a you fear that there's a mistake with the patient, and because she's being discharged, and she's worried that she might need continual medical attention.
Okay. So I'm going to be the RT. Eric's going to be the physician, and Marcelli's going to be the patient, okay? All right.
Oh, that's cute.
Are you going first?
Yeah. Miss Green, how are you doing? I'm just coming in to check on you. How are you?
You're muted, Marcel.
Miss Green.
I'm okay. I'm not feeling still not feeling myself. I understand I'm being discharged. I'm not comfortable with that.
I understand your concern. Just wait right here and I will be right back to check on you.
Okay, thank you.
Gonna go look for the doctor, the physician. Dr. Eric, hi. I'm just concerned. Do you think I can have a moment of your time?
I'm actually, you see me with a patient, so can you go and find somebody like a nurse before you come see me next time? I'm with a patient, so if you can go find a nurse, and if you can't find one, come back and see me. So
okay, absolutely, absolutely. Looking for a nurse. Hi, you know, I was looking over Miss Green's films, images, and I saw a slight concern. I saw that there was a gap between the apex of the lungs and the rib cage, and I'm really concerned that she's being discharged. What do you think I should do? That's when the nurse advises me to go back to the physician. So, going back to the physician. Hi, Dr. Eric, I'm really sorry to bother you again, but I am really concerned that Miss Green is being discharged. Please, can I have 2 minutes of your time and review this film?
all right, so you're able to find the nurse, so she was no help. Go ahead.
The nurse was in agreement with me that maybe you should double check the images, because she did see a gap between the apex of the lungs and the rib cage as well.
Okay, go ahead, order another x-ray, and let me know what's going on with her. And so far, don't discharge her yet. Take another x-ray, bring it back, and I'll look at it, and we'll go from there.
Okay?
Good. Thank you so much for your time.
So good. So you guys don't know all of the options you had. So he was the ER doctor. You could have got your radiologist involved and had him talk to that doctor. So good job. But at least you stopped him from discharging the patient.
I was trying to be like that a-hole physician that is with the patient, and
don't bother me.
Yeah, don't bother me. I'm with the patient. That's why I'm trying to look to the side, trying to be with the patient, kind of.
So there's a physician and there's always like a head radiologist?
Yeah, so the radiologist reads the x-rays and the physician is the doctor that's treating the patient that ordered the x-rays. So you could call your radiologist and say, I took a x-ray on this patient and I'm concerned that they're discharging her, but I don't know if they know that her x-ray was got this wrong with it, or can you talk to the doctor before they discharge her? So yeah.
Yeah, that's what I was saying, Elizabeth and Eric. That's what I was saying. There's always someone above us that we're under that we can address.
It's just not a nurse.
The doctor and the nurse. So
yeah, but you did fine. That was fine. And Zach has joined us. So group 6, we're going to go with your acting after we get done with our writing studio and APA format. So hold on to that, what you were going to present. Hello.
Hey guys, how's it going?
Hey.
How's everybody doing? Happy what's today? Wednesday? Yeah. All right, I'm not gonna take too much of your time. I just wanna kind of introduce myself a little bit and talk about APA style just for a few minutes, and I'm gonna kind of walk you through and show you around the online OWL class thing that you guys have access to and can use to kind of get a hold of me. And that's about it. So like I said, it won't take too much of your time. My name is Zach. I sit down here in the Learning Commons. I'm the writing studio coordinator. I'm sure some of you heard my spiel, one of my spiels at orientation. You know, I'm here for all of your writing needs, whether it's a research paper or you know, any kind of letter or assignment that you're working on, a project, a resume, cover letter, anything like that. I'm here to help with those things. Obviously, in your time here at Kaiser, you'll be writing everything, at least your assignments, in APA format. And so I want to talk a little bit about that today. Ms. Love, can you talk a little bit about the assignment that they have going on or is upcoming?
Yes. So like I told them, this assignment isn't really the in-depth APA that you guys are going to be using in the future assignments from our classes, but this one, as you know, is a business letter. It's kind of a letter to me telling me why you joined the program and some of your life experiences, what you're kind of concerned about or what you're excited about in the program. And then you're going to interview some of the upperclassmen and talk to them about their experience in the program and how you related to them in this letter. So it needs to be 1 page max. So we need to condense all this information down and not go over 1 page and answer the questions that were handed out in the instructions.
Cool. Okay, very good. So obviously not a whole lot of APA stuff within, you know, that assignment, but like I said, you know, in your time here at school, you'll use it quite a bit. So I'm here for that. If you guys want me to look at these letters before you turn them in, I'm happy to do that as well. With this assignment and really any assignment that you have, if you feel the need or the want to come and see me about it, all that I ask is you obviously bring whatever you have done so far for that assignment, but also the assignment itself, whatever those questions are, if there's a rubric or some kind of prompt or whatever it is, bring that as well, just so I can know exactly what Ms. Love or any of your teachers are looking for. Just makes everybody's life a little bit easier. So am I able to share my screen on here?
Yes.
I am, okay, cool. Okay, so I just want to walk you guys through real quick the online OWL course. So can everybody see my screen?
Yeah.
Cool. So in your courses in Blackboard, you have Kaiser Writing Studio, or the online writing studio, the OWL. And this is basically what it looks like from my end, so I can edit things, but obviously you won't be able to. So there's a couple cool things that are here. There's a discussion room or discussion board kind of forum thing where you can just kind of post general questions. And I have one from yesterday that I will take a look at here in a little bit. So these are general questions, can be about anything, writing, grammar, or APA style format, anything at all that you need to, that you have a question about. Obviously the quicker way would honestly probably be to email me a question. But this is also something that I check once or twice a day as well. So I'm pretty on top of it, or at least I try to be. So that's a tool for you guys to use. As I talked about in orientation a little bit, some of you may remember, you can get a paper or an assignment to me a lot of different ways. You can set up an appointment with me to come and sit in person and we can talk about it that way. You can email me a paper. You can send it to me and give me a call and we can talk about it over the phone. We can do it over Zoom like we're doing now. You can also submit a paper in the OWL and never have to talk to me, which is perfectly fine if that's what you prefer. So you can come in here, click on submit a paper here on the left. There's a little form that I ask that you fill out and attach along with your assignment. All that form really does for me is the important thing is your email address. So that way I can get your assignment back to you as quickly as possible. And I don't have to go into, you know, your class or anything and figure out what your email is. So the easiest thing to do is definitely to fill out this form. And there's also some questions in there, a little bit about the assignment. Again, if you have a digital copy of the rubric or the questions or the prompt or whatever, you know, you can send that as well. That's always super helpful. And then you click on this and you can just attach all those things, including the assignment. So you can attach everything here. You can write it in there as well. It's a little bit more difficult for me to kind of add notes and things to it. So a Word document is usually best. That way I can open it up, add notes and comments onto the side of it without actually altering anything that you wrote, and then send it back to you. And if you have questions, obviously we can communicate that back and forth. So let's back out of here. So that's kind of the main tool that we use. The other big thing in here, well, there's two other kind of big things. There's Safe Assign. which I don't really see, but it's something that you guys can use to kind of check yourself for plagiarism. You can come in here and submit a paper or an assignment or whatever, and it will print out, or not print out, but it will kind of feed you back a report of how much of your paper is taken from another source. Obviously, there's always some number that it comes back with because you use quotes and paraphrases and things like that. It's not the smartest tool in the world because if you have like references at the end, it counts those towards your plagiarism because those are all titles and things from another source. But it does highlight the areas that it thinks are copied from somewhere else. So if you look at that report in your paper and it's just highlighted the quotes and the references at the end, not a big deal. If it has, kind of highlighted some areas of your own writing that that it thinks is kind of similar to somewhere else, that might be something to take a look at. Again, I won't see this or anything like that. It'll tell me that you submitted, but I won't actually be able to see your paper or anything. So that report is just kind of for you to just kind of double check yourself and make sure you're not, flirting with plagiarism there. And then the other big thing here is the APA help, obviously. Now I have hard copies of all of these handouts here at my desk. I have like a little rack thing with a bunch of flyers and handouts. But these are all digital copies of those same things. So these are all going to be really good tools for you in terms of following the new guidelines for APA 7th edition. Excuse me. So the easiest way, if you're writing a bigger kind of research paper, there's all kind of guides in here that break things down in terms of in-text citations, how to do the references at the end, how to set up a title page, things like that. There's a whole kind of little presentation here that somebody else made and I put in there. But one of the easiest things to do is to download this sample paper. And what that is basically, I think it's like a psychology paper that the APA people actually provided for us. That's basically set up in perfect APA format. So sometimes what I recommend is if you have a bigger paper and you're not feeling so great about how to put it in APA format, just download that paper and leave the structures in place and just rewrite it with your own stuff. Obviously, I don't have any concerns about you guys using this paper and turning it in because it's a psychology paper and you guys aren't psychology students. So don't have to worry about that. But sometimes that's easiest, especially with the title page and things like that. It has everything kind of where it needs to be, so you can just kind of go back over it and type in what you need rather than kind of starting from scratch. A lot of people prefer to do it that way, which is totally understandable. So all of these are available for you. You can download each individual one. Again, I have these and more here at my desk. So feel free to swing by and grab anything if you want next time you're on campus. I don't know when you guys are on campus for class. See if there's anything. There's also Kaiser Live. Again, everybody should be enrolled in this course. So if you don't like Zoom or don't want to use that or Teams or anything like that, we can also do talk virtually in Kaiser Live through this course as well. So that's another option as far as communicating. I think that's it in terms of here. Oh, also myself, and I don't remember if she has hers on here. Yeah, Miss Lynn's information is also on here. She's one of our librarians. She was doing this before I started here. But my information is in here. I have to update these hours. These are not accurate. However, my email address is in here and is accurate. So if you need it that way, that's where you can find it. I also have cards here at my desk if you want that as well. If you need to get a hold of me quickly, you can just call the school number and ask for me, and the front desk will get you over to my phone. I think that's about it. In terms of this assignment that you guys are going to do for Miss Love, this letter, Miss Love, you mentioned something about personal communications or an interview of some kind.
Yes, so they're going to interview our students on Zoom and ask them any questions they have about the program. So they just need to include 3 students that they talk to in the paper and how they relate that to their feelings about things they might be apprehensive about or that they're excited about or how they connected with them somehow.
Gotcha. Okay. So in terms of
be a lifesaver, he's going to be your go-to person for that paper you're going to do. We have every positioning class You have to write a paragraph and reference it in APA style about your images in the book, and you have to have 2 of your sources from the program's books. Do you still have that list of our textbooks?
I do. There's on this little kind of, I don't know if you can see it, there's a little column here behind me. There's a whole rack of just your textbooks already done for your references and stuff.
APA for you, already done. Can you believe that, guys? So don't use those citation places. Usually they do it wrong for some reason. I don't know why. Some of them work good and some don't. So just make sure you double check your citation page. That's where most of our students get points off, by not citing or not doing that right.
Kevin, you have a question?
Yeah. So I know Ms. Love, you said this is supposed to be like a business letter, but also I think it said double space. So business letter, I know I've had to write some and do stuff similar to that in the military. They're not typically double spaced. So does this necessarily actually need to be double spaced? And if it's because we're interviewing 3 people, how are we supposed to incorporate that APA format into an actual
Don't
business?
worry about the APA format. The only thing that was for the reference page, and then the new edition does not have a reference page for interviews, so you don't even have to do that anymore. So
Okay.
yeah, I would think single space would be okay because it's going to be hard to fit everything on one page. I didn't realize it's a double spaced on there, so yeah.
Okay, that's what I was trying to figure out with it being a business letter, if it was,
yeah,
I saw the double spaced and everything else. Okay.
Cool. All right, well, that's just about all I have, guys. Yeah, of course, good luck, and let me know. I'm here for you guys, and let me know when or if you need me.
Elizabeth has a question.
Elizabeth?
Yeah, I'm sorry. If you have a quick
Go for it.
What do you prefer? Do you prefer in person, on Zoom, or online?
In person is usually best, just because we can both sit there and you know, like a hard copy, and I can write notes on it and kind of make edits as we sit there and talk about it together is always the easiest thing to do. You know, screen sharing and things like that on Zoom also make it pretty easy. So I'm flexible. Whatever you guys are comfortable with is fine.
Well, I just want to make sure you were comfortable with it, just because of like the whole, you know, COVID thing.
Yeah, no, everything's fine. You know, as long as you wear a mask, you're cool. You can come sit at my desk and we can talk about it.
And we're
do we have to make an appointment?
You don't have to. You can walk in, as long as I'm not doing anything else at that moment. I'm happy to help. But obviously, if you set an appointment, I'll have some time blocked out for you.
Okay.
Yeah.
Tuesdays and Thursdays. I was going to tell you that we're there Tuesdays and Thursdays. So
Okay.
that's probably when they'll want to try to come see you.
Sounds good. I'll be here.
All right. Bye.
All right. Thanks, guys.
Thank you.
Bye. Thank you.
All righty.
Miss
So,
Love, if
done.
could we go on campus like Monday, Wednesday, or Friday? Like if we needed to use the computer lab or?
Let me ask
Curious.
about that. I know, like if you make an appointment, of course you're going to be allowed to go there with him, but just to go in and use the computer lab, I don't know if they're wanting a lot of people coming in and using that yet. They used to, they highly encouraged it. And even when the hurricanes came and people didn't have power and internet at their house, they were letting people come on campus just to get in the AC and things like that. So with the COVID thing, it's a little different now because of the having to monitor the temperature checks and the cleaning of everything. I think that it's not an open for any time you want to come on campus anymore. But definitely if you make an appointment with him for writing studio help, you can.
Okay.
But if it changes, I'll let you know. Group 6, our last presenter.
Okay. Ours is about, can you hear me? Hello?
Yeah, I can hear you. Go ahead.
Okay. Ours was about pregnancy. We have a female patient that is sent to the radiation department, and they are hesitant about getting a pregnancy test. And so the radiologist technician is going to try to go by ethics and determine whether they should proceed with the radiation test.
All right, so I'm the patient, and then I forgot her name. Caitlin is the doctor, the radiologist. Okay.
All right, so hi, how are you? I'm Caitlin. I'm with radiology. Is there any chance that you are pregnant?
Hi, I'm good, and no.
Are you willing to take a test just to clarify that you aren't?
Does it really have anything to do with my treatment?
I highly advise that you do take a test, but if you aren't and you say you aren't, we'll have to get everything set up for you for the radiation treatment. So with ours, me personally, I would like her to take one just so like that doesn't weigh on my conscience or anything, and I bet anybody else would say the same thing. But when we were discussing it, we went through all the ethics and everything, and we went with the second one and the third one about the professionalism to provide services to humanity with full respect for the dignity of mankind, and then the concerns of personal attributes of the nature of the disease or illness or anything without discrimination. So we can't discriminate her because we think she's pregnant, even though we don't know for sure.
Okay, so we haven't went over a lot of this pregnancy stuff yet. So that was a good way to think about it. So with radiation, it could cause damage to the fetus, but if it's medically necessary for us to do the procedure, we would do it and take all precautions, or the risk versus the benefits. The benefits outweigh the risk. So if it was a direct x-ray to her abdomen area where the fetus would be, we would probably not want to do that if she was pregnant. There might be another procedure. The doctor might order an ultrasound instead where you didn't have radiation involved. So in our departments, there is a protocol. If anybody is of childbearing age, and that includes young teenage people, that we require, in some instances, a negative blood test or a urine test for checking for pregnancy.
Yeah, that's what I was saying. Every time I went to go get anything done, like x-rays, anything done with my abdominal region or even chest x-rays, they still made me take a test.
Yes. And I had a chest x-ray done when I was sick one time, and I've had my tubes tied, and they still did a pregnancy test. I was like, I got billed for a pregnancy test, and I knew I didn't need it. But they do pretty much require it. I guess the patient could always refuse it, and then it would become an issue whether the doctor wanted us to go ahead and do the x-ray with shielding, if possible, over that area. That's
They
what
bill you?
happens. Yeah, I got
Even though
billed for a
you
pregnancy
didn't.
test, even though I told them my tubes were tied and I wasn't pregnant.
But can't
That
you still
doesn't
get
seem.
pregnant with tubes tied?
That's probably their reasoning for it.
Yeah.
Yeah.
So is that only when you get an x-ray of the abdomen?
Mine was a chest x-ray. I guess it was close enough to the abdomen. A hand x-ray, not an issue. We're going to, if they're pregnant, we're going to do the x-ray anyway, usually, because we're going to put shielding on them. But yeah, so we do check pregnancy in the labs, or we would ask them, of course, still. And then this comes into another scenario that could happen. What if they come up positive for pregnancy? We can't be the ones to tell them. The doctor needs to go in there and tell them that they're pregnant because we're not diagnosing them. But I have had patients when I went to get them, I was like, well, your test came back negative. And they're like, oh, thank God. But I don't know. Probably I wasn't supposed to tell them. It was probably the doctor's job to go in and tell them that they were.
Yeah,
not
see, ours
pregnant.
didn't have that much background on it, and she was already going in for radiation treatment, so we didn't know, like, maybe she's already done the
Exactly.
test or, like, all this other stuff, so it was just
Yeah,
like.
it was just someone that was unsure. I think there was another scenario that it was a young girl with her mom, and would she be honest with telling you this? So we usually do that away from the parents. We ask them any chance of pregnancy without the parents there, or do their test results without the parents there.
So even though she said no, is it just because she hesitated, or because I feel like it's if you ask them a question, they say no, then what's the point of asking them if we're going to do a test anyways?
Anyway, exactly.
I feel you. Or are we just throwing pregnancy tests at everyone that we have to do?
We just always
X-ray
ask
on?
it. So when we start doing patient care questions, that's going to be one of your things on your comp.
Yeah.
You have to ask every female patient. And then we got the guys joking around asking if they're pregnant too. But it's a requirement for us to ask, even if we have the test results even. So we have to check the box. Sometimes there's a form they sign saying that they're not pregnant, and some places even have date of last menstrual cycle on there.
Do we look at like their patient information first?
Yeah, we'll go into their
Do that?
chart and look and see if they had a test done.
Okay.
How much does it cost?
I've had doctors ask if I was pregnant, and then still like other people would come in and ask if I was pregnant too. So
Yep, you get that repeat all the time. I think it was like $30
They're more expensive than if you was to do your
to
own
do it
birth.
at your house. Yeah. If you buy one at the store, I think they're $15 to $20. I don't know.
It just seems crazy. Like if you know you don't need one, it's like you're just $30 is just gone without. I don't know.
Welcome to the emergency room.
Yes. Oh, you know how much a Tylenol costs?
I had to do that. They gave me a Tylenol and I threw it up because they gave me, I didn't have strep. And she's like, we're just going to treat you for strep anyways because we're not sure what you have. And the spray like made me throw up right after I took the medicine. So I was like, can you like take that off my chart? Because I didn't
really
need that.
get it.
'cause
In
my
our
throat doesn't
scenario, you
hurt.
didn't throw up, so
Yeah. Thank God.
Oh, speaking of, and the award goes to
Oh,
Michael.
Yes.
glad this is recorded.
We have to go back and watch this. It said there were tears coming out of her eyes, and I was literally had tears in my eyes.
I did too. Oh.
Me too.
All right, guys, that's it for today. That's our critical thinking. Just everything you do, there's going to be choices that you can make, and you may or may not make the right one that time, but hopefully it'll help you for the next time you're in that scenario. But no matter what, as long as you get the images, that's what's important, and not get sued.
when is the worksheet for the chapter 4
So
due?
chapter 4 is due tomorrow.
Okay.
In the morning for homework tonight. And then chapter 6, I went ahead and kind of put them together, but chapter 6 is tomorrow's what we're talking about. So that's actually like tomorrow's homework after we get done talking about it.
Okay.
So when we do the business letter, we're going to interview 3 of the students that's in the class, correct?
Yep, in the other class.
Oh,
they're going to
another
come
class.
on our live,
Okay,
Miss
okay.
Osteen's class. Yep.
Okay.
So you won't be able to finish your paper until you've done that. So you can start planning it, doing your format, starting out what you know you can go ahead and answer on those questions, and then incorporate their answers into that and start thinking of what you want to ask them if you have anything you want to ask them.
Okay, I have a question.
Uh-huh.
So what is chapter 4 worksheet?
It's on the week. When you go under week 1, there's a little tab that says chapter 4 worksheet. It's a question and answer. Some of these scenarios are in there. Pick 2 scenarios and how would you handle them. So we already did that. You can just write it out.
Okay, chapter 4 worksheet due Thursday.
Oh, okay, I see
We
it.
just scan it in.
Under homework, it says that to read chapters 4, 5, and 6. So is tomorrow's quiz on 4, 5, and 6? What happens?
So tomorrow's quiz is just what we did today, 3 and 4. The 4, 5, and 6 reading is so that you're caught up for tomorrow's class, what we're going to go over 5 and 6, so that you kind of have already looked at it before we go over it.
Okay.
So just the quiz on today's
Chapter
stuff.
about like stress and all that stuff.
No.
Critical thinking is on the quiz tomorrow? No?
Yes. A little bit of the critical thinking, the stress, the managing stress and things from chapter 3 that we kind of talked about that you looked at. It won't be in depth on any of that. Mostly the critical thinking chapter questions from the back of the book in the chapter. Look over those.
Okay.
Are we all going to be interviewing the same upperclassmen?
We'll put you into breakout rooms with different people.
All right.
Yep. Bye, guys. You got a question, Aaliyah?
Yeah, for the worksheet, is it only 3 questions? Because all I saw was 3.
Yeah, it's not very many.
Okay, I just wanted to make sure.
And we can email that or use
upload it in that
upload
link.
it
When
in
you
the
click
link.
on it, there's a box that comes up. You upload it as a document. So it's a Word document.
Okay.
The worksheet is
just
5
type it in there.
questions.
Is it 5?
Yeah.
2 of them are
Scroll down.
scenarios. So scroll down. There'll be the 2 scenarios to talk about.
Now, the 2 scenarios are going to come out the book off the PowerPoint.
Off the book. The ones on the PowerPoint, some of them were from the book, but
Okay.
yeah, just off the book ones.
And that master syllabus that need to be signed and uploaded for a grade, do you need to sign that before we upload it? It's in a structured signature.
Yeah, you can just sign your part. I just save it for Miss Dean in case she ever needs it. And like I told a couple of people yesterday, it's just to show that you got the syllabus and everything. And I updated the week 1's kind of yesterday to fix it so it was what we were actually going over today
Tomorrow's
and tomorrow.
quiz is on chapter 3 and
3
4
and
of
4.
patient.
Yep.
Yes,
And
sir.
then tomorrow class, we're going over 5 and 6.
So the
So that's
quiz
why the
tomorrow
reading.
is 3 and 4.
So critical thinking and studying. I think it pretty much will be an easy quiz, hopefully.
Yeah, Danielle asked
Professor,
about HIPAA.
my terms opened up, so I was able to submit it.
Okay, sounds good.
Yes.
HIPAA. Good question. So I forgot to tell you guys about that. Let me share screen a second. There is, with your CPR class, the same company does our HIPAA and bloodborne pathogen training. So you guys have this, and it's not due till week 4, but I put it in week 1, the links. He gave them to me yesterday. So scrolling down right here. So this is due week 4. There's a little place for you to upload your certificate when you're done. You have 2 chances to take it. Kaiser paid for the courses for you, so you have 2 chances to pass the test. I don't think it lets you go back and forth between the reading and the screen, so you need to save notes somewhere and have them when you take the test. I have had one student not pass it the 2 times, but in all the years, that's only one I ever have had that happen to. If for some reason you do not pass it within the 2 times, you have to pay for the course yourself. When you go log in, I don't know if it says it on these little certificates how to do it. It's going to look like you're having to pay, and you do not. There's a code you put in. It's on the little directions when you go to their website.
Just in case, like, something bad happens and we do pay, how much is it?
I think it's $30.
Okay.
I'm not 100% sure on the cost. You're not going to not pass it. It's not that hard.
Cost of pregnancy thing.
Okay. Why does it not look like it's opening? Okay, this is the coupon code, HIPAA 2020. So when you log into the website and you go to checkout, in your little checkout, you're going to put in that, and it's not going to charge you.
I'm sorry, what is that for again? Online class?
This is, you have to have HIPAA and bloodborne pathogens training before you can go to clinic. So we do it in this class. It's not due till week 4. So I'm giving you the whole 4 weeks to complete this. So whenever you have the time, you can come in and out, log in and out, go through the little videos and links that they have, and do one certificate and then do the other one.
And do we need to print the certificate out?
When you get your certificate, you want to save it to your computer and upload it.
Okay.
And save it for a job when you go to get a job, and for Miss Stelz for clinic, because you have to use those when you go to clinic too.
Where is it under again? I'm sorry.
Under week 1, let me just go back one screen.
Okay.
And then at the very bottom.
Oh, the HIPAA course. Oh.
Yep.
Wow.
I have a little folder with these 2 certificate picture links in this folder. And then when you go to week 4, if you go ahead and get your certificate before then, I don't see my weeks. Anyway, in week 4, I have a little assignment uploader for you to upload it.
And
so whenever you're done, you can go in here and upload your certificates. So they're not due till, I believe it's on our syllabus, like the 22nd. It's Tuesday of week 4. That way I got a couple of days. If you don't do it by then, I can get on you and keep messaging you and telling you you need to get it turned in by Friday. So CPR, I did update the schedule yesterday. We had some people that were on there that aren't in the program that didn't come. So I moved people around because she needs 10 people in it. Is that week 2 CPR? I might need to go to week 2 folder. So if you already looked at that schedule, your time is probably a good chance it might have changed. So I want to look at that with you guys too.
So we don't have class that Thursday, right?
No class Thursday. And instead of coming to campus on Thursday, you're coming in on Friday. Thursday morning, you will log in at 8:45. There's 2 handouts that he has gave us to give you. You're not going to have a quiz that Thursday.
Okay.
So you will come online to this link on Thursday at 8:45, and you'll have those handouts he wants you to have that are above this. And then Friday schedule, here's your times you're going to come on campus Friday. So some will be 11 to 12, some will be 12 to 1, and some will be 1 to 2.
So that's the time we're going to campus. We don't have to go at 8 a.m.
No, just at your scheduled time. Now, that morning we will have our exam at home at 8 a.m. on Kaiser Blackboard here. We will do our exam before you go to CPR because you'll be done with your exam by 9:30 or so.
I have a question.
Uh-huh.
I sent you over my CPR card.
Yes, so I
That's
need to
good.
get with Miss Dean and let him know you won't be there. So you'll be
Okay.
at this time.
Okay, so then I can just exclude this from
I
the
haven't heard back from Miss Stelz if that was okay, but Miss Dean said she thinks it's fine.
Okay.
So I'm sure
Yeah,
you're
if I do
good.
that too, can I just show you? Like I literally just did it maybe 2 or 3 weeks ago.
As long as
And
it's
I
the
have the card.
BLS,
basic life support.
I think it has to be American Heart Association certified or something like that. Just send me a copy of that. I think that's good. And I'll send it to Miss Dean too. So who is that, Jessica?
Yes.
What
Because
time
it's
are
good for
you?
The
2
BLS
years.
provider,
Okay.
American Heart Association.
Yep, you're two different groups, so that'll be okay. Hopefully, I won't have to move people around again. I think it'll actually be better to have less people.
I have one.
What day was that supposed to be on?
Friday, next Friday.
Next Friday?
Yep.
I have one too, but you said if it expires before the class ends.
Yeah,
then-
before your graduation.
Yeah, because
it's
I
every
just got
2
it
years,
last
right?
year. It's been a year, so it's another year on it.
They're good for 2 years.
Right.
Yeah.
Okay.
So you
But if I got
might
it last
be
year,
yeah, but I thought CPR was good for 2 years. Is it good for only a year?
Yeah.
now?
I have the BLS, but it's good for 2 years. But I got it in October last year, so that
October of next
I
year.
just got it.
We
literally
won't finish
I'll
until
say a
December
month
of
ago,
next
and
year.
it says it's fine until 5/2022. So the BLS American Heart should be 2 years.
So you might need to go ahead and take the course just so you're good throughout the program.
that's what I was
Me?
thinking. I may just
Oh,
No,
take it.
no, Tarawala. Yeah. So you might as well take it so you don't have to go ahead and
They are
in
good for
a
2
little
years.
while get another one done. Yep.
Who do I
So
need to
under
send that
CPR
to?
is everything. Huh?
Who did you tell me to upload?
Email
or
it to
send?
me and I
Okay.
will send it to Miss Dean and Miss Stelz and get permission to make sure you're good. After
Okay.
you email it to me and I send it to her, I'll forward a message back to you saying if you don't need to come or not.
Yes, ma'am.
So we're going to be doing
Sounds good.
CPR Friday.
So Friday is the actual for that 1 hour where you perform it.
Okay.
Thursday is online where you learn everything.
To learn, okay. And that's next Thursday the 10th.
Yep.
Man, so we don't have.
Be allowed to switch
So
I'll probably
next
ask
week
another
we'll only
question
be on
before you.
campus one day with me,
Okay.
Tuesday. And then we're off on Monday. So we have
Off Monday.
Wednesday where we'll do a talk or a lecture, and then we won't have anything on Thursday. Ooh, that reminds me.
And you said our exam Friday is
It's
going to be
Friday.
online, starting at 8 o'clock.
Yep.
So,
Okay.
so we have no quizzes or anything on Monday?
Nothing on Monday.
Or
Nothing on
Thursday, right?
You're off. Nothing on Thursday.
Man, so we have a super short week next week.
Short week. So
Yeah.
Tuesday and Wednesday
Justin,
we'll
I
be
don't have
going over our
CPR.
chapters, and then Friday will be our exam.
Okay.
Are
The
we
exam
coming
on
in?
Friday, is that where we do the thing where I have to have something record my
Yeah, so just a phone to be kind of on video, and then your computer to take the test if you have that capability. If for some reason there's an issue and you can do your video from your computer screen, we can do that too.
like we're like this?
Uh-huh.
Because my phone kind of sucks, so I don't know how well it's gonna do.
Okay.
Sorry.
So this is fine if I take the exam like this.
Yeah, I would just have you show
I mean,
me
you can
your
tell
area.
if I'm switching.
Yeah.
Oh, you guys are talking about next week's exam?
Any
This
exam
week's
we're
exam.
doing on video,
Yeah.
yeah.
On video?
You have to be with your phone videoing you from behind to see your monitor, or your computer screen on video so I can see your monitor keyboard
So
area.
like share your screen. So if I just share my screen, it's okay?
Yep.
Oh, I've never
Okay.
done
Because I was
that.
about to say, I'm confused because I have like nothing behind me to help do that.
To hold it. Yeah.
Yeah.
So just as long as you can see your computer screen a little bit, your keyboard and everything. Yeah.
Oh,
it can be
so
beside you.
basically I can like put my phone and just have my phone recording.
Yeah. So you'll basically be taking it on your computer and recording it with your phone instead of using your computer as the recorder. Your computer will be used for the Blackboard test.
So do we need to send you the recording or?
We just need to watch. I'll be sitting here watching you like you were in front of me.
We'll be on Zoom on our phone.
On your phone.
So we need to put Zoom on our phone.
Yeah, and you can do it from the web. You don't have to download anything. You can just type in just like you do it on your computer. Yep.
Okay.
Are we allowed to switch times with people? Like, so I'm 11 to 12. Could I, if someone wanted to be 11 to 12 and maybe 12
I would have said yes, but I just sent it to the guy yesterday. He needed the list of everything.
All right.
So
I will check and see if he cares, but
no, it's okay. It just like
Okay.
works time a little bit better, but I'll figure it out.
All right.
Okay, so basically I can try to makeshift something so I can put my phone and so you can see the screen.
Yeah, so
Right.
just like putting it like beside you if you don't have a table behind you like I don't or Jessica doesn't. You can just put it beside your computer screen somewhere on the table so it's just facing your computer. We don't really need to see you. We just need to see your computer keyboard area.
With my phone recording it. Okay.
Yep. Go ahead, Jessica.
So
Through Zoom?
I'm going to do the share my screen. Should I can put it on mute too?
Mm-hmm.
Okay.
Yep.
I might make noises. I might be like,
Yeah, everybody will be on mute.
No swear words.
mute, but I'll put share my screen. So that works. Okay, thank you.
I think I'll just make something like a little container and just
You can put it in a cup or something, like a
Yep.
little coffee mug
yeah,
cup.
or like I'll put it in like a red solo cup and just staple it to